All right, I'm ready whenever you are, Whitney. Oh,
Are you waiting for me?
yeah, I could see your audio connecting, so I was.
Okay. Sorry. What for some reason you don't your audio doesn't show up on my computer. So I jumped on my phone. So yeah, we're ready whenever you're ready to go.
Okay. Kallie and Tracy, you guys good to go? Good.
I am. Thanks, Matt.
Yeah, so welcome everyone to our weekly press call. I'm going to do the surveillance report. I'm going to say a few words about the people that are working with us and for us on our incident command, and then turn it over to, maybe I'll do Tracy first this week, and then Kallie second. Just no for no particular reason. That sounds okay to everybody. Um, you'll see that and hear me okay. So here's our weekly surveillance report. As you can see, we continue, our February plateau continues. At least with case numbers, we had 32 cases per 100,000 during the most recent reporting period, the week that this reflects. That's an increase of about 23% from the 26.1 cases we had. But again, in the context of where we've come from since November, it really continues to be fairly stable. We've had some bigger days this week in terms of number of cases, but this is just, we're watching. We're really hoping that we see this start to go down again, because as we look at this in the context of November, it looks like we're down. We are. But when you look at this in the context of the entire pandemic, we're still above any point we were before November, um, including during last summer's surge. So we really would like to see these numbers come down some more, of course, because the fewer cases we have in the community, the less chance we're going to have people in the hospital, and the less chance we're going to have mortality. Our percent positive of tests in the community are very similar, up a little bit, up to 5.8% overall in the community. And I'll have to pull what the number is outside of Big Sky. I'll do that when Tracy or Kallie are talking. I forgot to do that before the call, but you can see that number creeping up a little bit, but not to the extent that we would, really take too many lessons from it. We continue again. That February plateau has been pretty consistent, pretty solid all month. Some good news here is the median time from specimen collection to the date that the results are received by public health is down to 1 day this last reporting period. Really, since the end of January, we're seeing really impressive turnaround in the tests that are being run, the diagnostic tests the PCR tests that are being run. That's good news because it allows us to get our contact tracing started sooner. As you can see here, most of the cases that we're seeing are the investigation is being initiated in less than 1 day, and that's what we want to see. Here's the epi curve for the epidemiological curve for onset date for those cases that we do have. You can see November continues to be the high point of the pandemic. We hope it stays that way. We hope that we can continue on through late winter and spring with lower numbers, but that will depend on behavior. It'll depend on vaccine supply. It'll depend on a lot of things. We continue to see higher numbers in people in early ages, 20s and 30s. You can see that the curve for people in their 20s got a little bit steeper starting in January. We're going to keep an eye on that. But our numbers at MSU are pretty stable. We had 36 new cases during the reporting period. That's up. That's higher than it has been the previous weeks, but not dramatically so, not exponentially so. And we continue to have the number of people who are active cases is well within MSU's capacity to do isolation and quarantine. That's good news. Had quite a bit of activity in schools, working with a lot of different schools. These are the active cases. There are many more students who are being quarantined based on these cases. And we're continuing to see some relatively small number of cases in long-term care facilities. We're monitoring that both in staff, predominantly staff, but also some patients, and that's a bit of a concern. And then I'll let Kallie talk about bed capacity. You know, beds are one measure, as I always say. It's looking pretty good right now, in terms, especially in the critical care. Again, these are snapshots in time, and they can change very rapidly. And what goes with the beds is the people. And I think, can y'all still hear me? I think I'll use that as a bit of a caveat, a bit of a segue, I guess, to talking about our people. You know, in addition to the contact tracing that I just referenced, this week we had clinics at the fairgrounds. We had 2 second dose pods at the fairgrounds, points of dispensing at the fairgrounds clinics. Bozeman Health had a 3-day point of dispensing up at their facility, I believe. So those were also second dose. Later on this week, MSU is going to be doing its second dose clinic, I believe. And we had a C8 Community Health Partners had a first dose clinic this week. Next week, we're going to shift back into some more first dose clinics. There'll be clinics run in West Yellowstone and Big Sky at the fairgrounds. We'll be doing another CHP clinic. I mentioned Big Sky Medical Center, as well as some second dose clinics also happening at the fairgrounds and Bozeman Health. The vaccine that we're getting, you know, somewhat higher allocations of vaccine, and we're working with our partners to get those into arms as rapidly and readily as possible. I just want to pay respect and gratitude to the many people who are working their hearts out to make this happen. This is not easy. It's complex in terms of planning. It is hard work at the points of dispensing. It's a testament to them that when you show up at these places, they seem calm and orderly, and they're being run efficiently. But there's a lot of hard work that goes into that. A lot of hours that happen both within the walls of that clinic, but in the background at the health department, at the emergency operations center, across the parking lot. And I know for a fact that the folks at Bozeman Health and Montana State University are going through the same thing. And I just want to acknowledge that, and I want to ask the public to also understand that we're getting almost, you know, I think within a week or two, we're going to hit the 1-year anniversary of the first case of COVID-19 in the state of Montana. We've had over 1,300 deaths. We've had over 500,000 deaths nationwide. We have been at the brunt of it a lot of times in Gallatin County. Our staff at the health department, the staff at the emergency operations center, Bozeman Fire Department, Fort Ellis Fire Department, you name it. I am going to miss some people here. Bozeman Health, these people have been working an inordinate number of hours under a great deal of stress, and sometimes without a heck of a lot of gratitude. And I want to recognize them, and I want to ask the public as they interact with our staff, whether it's at a point of dispensing, whether it's on a phone call with a contact tracer, whether it's calling our call center, whether it's just visiting your doctor's office, your healthcare provider, please understand that these folks are stretched. They're tired. They're doing it for us. They're doing it for the community. And I don't know where we'd be without them. I really, it's humbling, and I want to express my gratitude to everybody who's pulling on the rope there, because it is a lot of work. And it's on top of all the other work that we have to do at a hospital or at at a health center on campus or at a pretty diverse health department. This is hard stuff, and I just want to. And we're not done yet. We have a ways to go. We can see some light at the end of the tunnel, and I'm reading some epidemiology now that has some optimism. But I also want to recognize that this has been the toll that has taken on the country and on the state is enormous. Earlier this week, we had 1,348 Montanans had died. We've had over 4,500 hospitalized. I think roughly 24% of those deaths were to people under the age of 70. Just this month, the death toll nationally has gone from about 445,000 people to over 500,000. That's nearly 50,000 people in the course of 1 month. That's staggering. And I think sometimes there's that old saying that, you can, if you turn up the water and you heat the water slowly, you can boil a frog and he doesn't even know it's happening. And I think sometimes we lose track of how big of a toll this pandemic has had on our country and our state and in our county. Today, we announced two more deaths, unfortunately, the first ones that we've had in a little bit of time. So I want to take a little bit of time and pay some respect to those that we've lost and to those who are working really, really hard to avoid additional deaths and to continue to get people vaccinated. With that, I'll turn it over to Tracy.
So we will be doing our second dose mass vaccination clinic tomorrow. And that is, it is for the second dose only. We're not doing any first dose. And that's all for individuals who are identified as eligible in phase 1B. We expect to run about 806 people through that second dose clinic tomorrow. And yeah, it's a ton of work. We've probably had hundreds of hours go into planning for these mass clinics, and we will have about 170 people there to help staff it through the day. But that's all I have for today.
Thanks, Tracy. Kallie?
Yeah, thanks, Matt. Thanks to everyone for joining us today. Our team continues to do excellent work in immunizing our patients. We've heard great feedback from patients who have shared that they feel the vaccine clinic at Deaconess Hospital is very well run, easy to navigate, and that a focus on safety, social distancing, and infectious disease protocols is very apparent every step of the way. So we take great pride in that, and we're pleased our community feels safe coming to us for care. To date, we've administered 6,133 initial doses to patients and 3,141 second doses to people in this community. We continue to reach out to patients directly as we receive vaccine allocations from the state. Our next vaccine clinics at Deaconess Hospital are March 2nd and March 9th, and we have one in Big Sky on March 7th. We're closely working with our IT team right now to tighten up our data sets to ensure that those who have received their vaccines aren't included in our patient list of folks for us to still contact. This coordination between multiple software systems as we've navigated mass patient communication and scheduling hundreds of patients at one time on our clinic days is very, very complex. We are an organization committed to process improvement, and we continue to learn a lot every day throughout this pandemic. I do want to mention that as we continue to immunize more patients and our partners at the health department and MSU and CHP administer vaccine as well, that our overall testing demands for COVID-19 tests have started to decrease. Our operations team is evaluating the hours and locations of our drive-through testing sites right now, and I do expect we'll have some changes in those sites and their hours of operation in the weeks ahead. We'll continue to keep everyone updated on those changes to our drive-up testing sites, and our website and social media sites are updated to ensure that they have the most recent information as well. Moving into bed capacity, currently at Deaconess Hospital, we have 60% of our critical care beds occupied, as Matt showed in the pie charts there, and 86% of our non-critical care beds are occupied. We continue to work very closely with our partners on this call, and we really appreciate everything everyone is doing to meet the needs of the community at this time. Thank you.
Wow, quiet group today.
It's Friday. We're feeling the Friday.
Must be a big news day. Are there any questions out there?
I have one. This is Holly Michaels with Lee Newspapers up in Helena. How are you guys all doing?
Good, Holly, thanks.
I am calling because we're tracking legislation up here that would limit health boards' ability to adopt local regulations. It kind of looks like that's the main bill moving through right now. There's been a lot in flux, but I'm kind of wondering your perspective if you're tracking this legislation and sort of what your thoughts are on if any of the abilities that you have right now to put in place measures were pulled back, sort of how that would change your job, you know, if for some reason we hopefully don't see spike in cases again, but if we faced a situation like we did, you know, over toward the end of the summer, late fall, sort of what that would mean for you and your position.
Well, it's a good question that's really hard to answer because there's so much legislation, and the legislation seems to be setting up processes that are more convoluted and confusing. And so it really creates a situation. Some of the legislation says that actions by boards and health officers need to be reviewed by governing authorities or supervising authorities. And in a lot of counties, there's more than one governing authority. So in Gallatin County, Missoula County, Flathead County, Lewis and Clark, Cascade County, we have city county health departments, and we're supervised by more than one governing agency. So in Gallatin County, that's the Gallatin County Commission and the Bozeman City Commission. And the legislation really doesn't decisively answer the question of how we deal with that situation, how we have the reason that we have a board. One of the reasons we have a board of health is to allow cities and counties to work together and not duplicate services, and they appoint board members. It's a little bit confusing to me because, you know, county commissions and city commissions for decades have had the discretion to appoint board members. They've had the discretion to decide how boards are set up. They can remove board members, and the elected officials on those commissions actually serve on the Board of Health, as they do here in Gallatin County. So it seems like we're moving toward a process where that's more confusing and more convoluted, and it's raising a lot of questions about exactly what this is going to look like at the end of the legislative session. We're plugged into it through the Association of Montana Public Health Officials, but frankly, health officers throughout the state have a lot on their plate right now. We're trying to run vaccine clinics efficiently. We're continuing to see a significant number of cases that need contact tracing. There's test sites that are being run in parts of the state, not to mention all the other things that go with running a health department. And we've been at this for a year. So I don't know. We've expressed our concern about some of the confusing nature of some of the legislation. I'm not sure that's being heard totally. And it's pretty concerning because I don't know that there's really clear answers on how a local public health system is going to work once this legislative session gets finished.
In terms of, you know, if some of the things that are moving through that would do something like require approval, would that present issues just with the timeline? Like when I'm imagining situations where you'd need to act quickly, just wondering your thoughts on that.
Yeah, I mean, it depends what legislation passes and how it's interpreted. And so, does it apply to just emergency rules? Does it apply to all Board of Health regulations? Does it apply to all health officer orders, or just those that are related to an emergency situation? You know, if we've got a situation where somebody is dumping sewage into a river or into a manhole, which we've had in the past, if we've got a situation where um, you know, you know, refrigerator coolant has spilled onto meats that could be distributed, and we need to issue a health officer order, which has happened here in the past. If we have a situation, an emergent situation, it's unclear to me who I have to go get approval from and how we're going to do that with the public processes that we have out there. Part of the reason it's unclear is because it's unclear which legislation is going to pass. But then part of the reason it's unclear is some of the legislation itself is pretty unclear. Who do I have to go to the Bozeman City Commission and the Gallatin County Commission? What if they disagree? One piece of legislation said that they have to agree in the interlocal agreement. One has to essentially cede control to the other. If you know anything about Gallatin County, I'm not sure how that's going to work. It's been tough in Gallatin County to get the city and the county to work together on a lot of projects, and I'm not sure this is going to be that much different. Actually, the health department has been one area where the city and the county has really worked together well, I think. And so I'm hoping that we come through this and we can continue to have boards of health that both have the responsibility, they have the duty, but they also have the authority to carry out that responsibility. One of the biggest concerns I had, and I've been talking about this for a long time, is that it's a pretty big responsibility to give local boards of health to take actions to protect the public health. That is not just a power that they have or an authority that they have. It's a statutory duty that local boards have. If you divorce that duty from the authority to do that's a pretty fundamental problem, and it's a pretty big, in my mind, it's a pretty big error in management. And so we're trying to make that case. We're trying to help them understand that. But it's a confusing situation in Helena right now. And I don't think any of us can answer the question of what this public health system is going to look like when they're done with it. I guess to expound on that a little bit, doing this during a pandemic does not seem like the optimal time to do it. It would seem like one option here would be to study this issue, to better understand it, to take a deep breath, to get away from the heat of the pandemic, and to really work to improve the system, which we're really eager to do. I think there's absolutely ways that we can improve our public health system. It feels risky, and it feels uncertain to do that in the middle of a pandemic, when local health departments are really, really pressed trying to give vaccines, trying to do contact tracing, and trying to keep the community safe.
Kind of to flip that, I'm wondering, is there anything that you wish legislators could be working on? I mean, it sounds like studying things is something you'd like to have them approach. Is there any problems or issues that have come up that you wish could maybe be addressed this session that are worth attention? Or just wondering if there's anything out there you're seeing.
I'd have to think about that, Holly, a little bit. I mean, to be honest with you, I haven't given a lot of thought to creating legislation in Helena over the last year. I'd have to think about that and get back to you on that.
Understandable. You've had plenty else to deal with.
Yeah.
I don't want to dominate this time, but I am kind of curious. I was just thinking about this week, like we're hitting, pretty soon here, kind of the year mark of living in the world we do now. And you kind of touched on this earlier about not wanting to, let the magnitude of this all make it seem not as big of a deal just because we've been doing this for so long. But I'm kind of wondering your reflections as you're hitting a year mark here of just, like, I've been going through and thinking back and looking at old stories and how different perspective is, but I'd love to just get your thoughts on how you're in, just what you're thinking about, what's in your head as we're hitting that landmark.
You spend so much time in the thick of it. I think it's important that we all pause to think about the people we've lost. I mean, we've lost over 1,300 Montanans. To put that in perspective, we lose around 220 people to car accidents every year in the state of Montana. We've lost 500,000 Americans and counting quickly. I mean, we're losing thousands more every day. And I think it's important that we remember that, and that as we move through this, I know that people are really anxious for this to be over. Nobody is more anxious for this to be over than people who work in local public health. But as we look out ahead, and it energizes us to work on vaccine distribution. It makes it really important, and it makes it feel, it keeps us going, and as we're doing contact tracing. And I just hope that the public continues to understand that this continues to be a really serious virus. While our numbers are better than they were in November, they're still fairly high. We still could have a surge in the spring or early summer. We need to really bear down, use the vaccine that we get in a timely way when we do get it, but continue doing those things that help reduce spread, help protect people who are vulnerable. Those things like social distancing and using face coverings, washing your hands, staying home when you are sick, and being aware that when you're out, even if you feel totally well, you could be transmitting the virus. And we just need people to continue to bear down, because what we do this late in the winter and in the spring could really have an impact and whether our summer is more normal or not. I think there's some hope that we could be headed toward a summer with more normalcy, but the things that we're doing right now are going to have a direct impact on that. And that's really what I'm aware of. And just as we move through this, I'm aware of, as we've moved through, in the early days, Gallatin County was really at the point of the spear we had more cases more rapidly in Gallatin County very early in the pandemic. That was very, very challenging. And then things subsided. We had the stay-at-home order, and things subsided. As we moved through time, we had the summer surge, and then we had the surge in November. And it feels like we're kind of in this cycle where we have these upswings. We get some community interventions in place. People start getting more cautious. They start being more careful. Things calm down for a while, and then things loosen up, and people relax a little bit, and then you get another surge. We need people to continue to bear down. I'm not saying we don't change anything. We're going to look for ways that we can open up safely, but we need people to understand we're not done with this yet. This virus is not done with us. We continue to lose thousands of people a day. We reported 2 deaths in Gallatin County today that have happened in the recent weeks. So that's what I think back on. We've been through a lot together. We're not done yet, but with this vaccine, with summer coming, with the immunity that we're building naturally, I think we have a reasonable path into a summer that perhaps will be more normal. But if we don't do the things now, if we don't pay the price now, we might not give it that dividend in the summer the way we want to. I don't know if anybody else, Mike, Kallie, Tracy, you have anything more to add?
No, I just know that we have learned a lot about how to quickly mobilize changes through our system. We've learned how to be extremely nimble, and although there will be specific things that we learn regarding pandemic preparedness and infectious disease management in general, I think the whole bigger picture of how we can execute change rapidly throughout our system will be huge learning opportunities for us that we'll take into the future.
I think it's worth noting that, from what we're hearing, that in the calendar year 2020, COVID-19 is going to be the 3rd leading cause of death in Montana, behind only cancer and cardiovascular disease. It's way outpacing the number of people we lose to really serious problems like motor vehicle accidents and suicide. It continues to be really serious. It's been a really trying year. What I think back on more than anything, though, is the commitment of the people that are working really hard, and how much goodwill I have and I feel in the community to work together to get through this. And I hope we can continue that.
Awesome. Thank you both so much. Appreciate that.
Yeah, thank you. Other questions?
Yeah, I have a question. Kallie, you mentioned that Bozeman Health is thinking about reducing its drive-through testing. And I just wanted to see if there was a general reduction in the number of tests the county is doing and what kind of has caused this decrease in demand.
Sure, I can answer that just from a volume perspective. We have seen a significant decline in the amount of tests being requested at our drive-up testing site. It has been noted that during specific hours, we have no volume of people coming through our drive-through testing site. So we're looking at the times when our volumes are significant, and we're going to decrease our hours on our existing days to reduce the amount of staff that's required for those times when we aren't seeing patients come through our drive-up site. What this will allow us to do is redeploy those staff to other altered operations like entrance screening, vaccine administration, and other areas where we can really utilize them more effectively.
I'd note, Perrin, when we look at the overall number of tests that are being done in the county, we're not seeing an overall dramatic decline. So we might be able to, what we might be seeing is more of a diffusion of where tests are being done. We're seeing tests done in more places. We're seeing more surveillance testing happening in different places. So it's hard to know because the testing system is, in a good way, become more diffuse and become more diverse. But when we look at the overall number of tests that we are getting reported back to the health department, I haven't seen a dramatic decline in the number of tests overall.
Yeah, and I will add one last thing. We are continuing with all of our other testing sites. So our retail health locations, our urgent care in Bozeman, Belgrade, and Big Sky, and our on-site clinic testing that we have here. It's just the drive-through that we're contemplating shifting hours.
Any other questions out there?
Hey, this is Emma with NBC Montana. I just had a quick question. I know you didn't mention it all this week, but I know you mentioned last week about asking the community to just really be aware of whether or not they're eligible in a phase when registering to make sure that vaccines are going to the people who are supposed to be in phase 1B. I was wondering if you have seen that continue. I know you mentioned it wasn't a ton of people, but if you could just speak a little bit about if you've seen that continue and if this is still an ongoing issue and how the health department is kind of working to just mitigate that.
Well, the number one way is we're trying to communicate with the public to help them understand the process, to help them understand that if they are not in 1B, we don't want them trying to get an appointment right now. Even if the opportunity presents itself, if you know you're not in 1B, please don't try to make an appointment. We're doing that in a number of ways. We're doing it by talking to you all. We're doing that when we're on our website. We're doing that when we're asking people to make appointments. We're doing that at the vaccine administration site. We're also looking at, I can say at the fairgrounds, we're looking at whether people have those underlying conditions by what they're reporting to us when they sign up. And if there's somebody that's signing up who is not reporting underlying condition, then we're canceling that appointment. It's hard to know because this week has really been about second doses. So they've been, by definition, a lot of people that we've already seen. And so we'll know more in the days and weeks ahead. What's important is we get a lot of feedback from people. We've gotten calls. I know Mike has gotten calls from people who just genuinely, they want to do the right thing, but they're confused. And so we're trying to spread information. We're still in 1B. We're still seeing high demand. We had, signups for some clinics clinic next week. I think we had roughly 500 doses and they went in like 9 minutes. So we're still seeing really high demand. And we're going to be in 1B for a while here in Gallatin County until we get some more vaccine. and more predictability in terms of if we do get more vaccine, we need to know we're gonna get it so we can plan for it. We can make sure we administer it. So I'm not sure we're seeing a big difference, but again, we've been doing second dose clinics this week. So these are people who we've seen before. I don't know, Kallie, if you've seen anything differently.
Yeah, we are mostly doing second doses this week, but ways that we're trying to really make it clear to individuals for whether or not they should schedule on our scheduling software platform. It asks them if they meet that criteria and lists that for them. And then additionally, when they come in to check in for their vaccine appointment, we're asking them those same questions again. So we're trying to put multiple processes in place that help them understand whether they're eligible or not. And that's then when we have to partner with our community on honesty and integrity with that.
And then, at MSU, I know MSU has an advantage because they have the student health center, they have student records, and they can really proactively reach out. So that, I don't know if you want to talk about that, Tracy. That's a lot of work for you guys, but you have a little bit more visibility in terms of whether people are eligible or not, right?
Yeah. So, yes, tomorrow is only second dose. So these are all people who have already gone through our system getting a first dose. And Matt is right. I think we had a different situation in that, our students utilize our on-campus University Health Partners clinic. And so they end up developing a health record there. And our clinic was able to go through their records and determine what students had, a pre-existing qualifying underlying health condition that allowed them to be identified as being in phase 1B. And then we have both employment records and student records where both employees and students had self-identified themselves on their records as either being over the age of 70 or being a person of color. So we were able to very precisely identify a group. But I will say that even though we had identified this group and reached out to them and only them, on our first dose clinic, we had people just coming in off the street who, some of them had no affiliation at all with the university, asking us to vaccinate them.
A follow-up for Kallie. I know you mentioned, obviously, you're kind of asking those questions at multiple points. Have you had any instances where you've had people show up in person who may have checked that they were eligible online, and then when asked those questions again, were turned away?
We have had instances where individuals haven't been actually eligible and they have signed up for an appointment. So we have had instances of that, and we're dealing with those on a case-by-case basis. But we're looking through our processes, really trying to boost our communication to help patients understand what our processes are. And one of the main points that we want to hit really hard with the community is that we will reach out to them. And if they have not heard from us directly, then we ask that they do not schedule an appointment. If they've received the link from someone else, we ask that they do not use that link. They should use the link only if it's been provided directly from us.
And last thing, this is kind of for any of you, and I know you've touched on it a little bit already, but what would you just want the community to know about how this can affect in a negative way your process of getting those vaccines out? How can it kind of hinder your ability to get the vaccine out to people who really need it?
Well, every dose of vaccine that goes to somebody who's young and healthy with no underlying conditions is a dose that's not going to somebody's grandmother or grandfather who's in their 70s or 80s or 90s. Every dose that goes to somebody who's not in 1A or 1B is a dose that's not going to somebody who is. And those people are higher risk. they're at more risk for hospitalization. They're at more risk for mortality. And so I just ask people to think of the big picture. Americans are not used to dealing with scarcity in their healthcare resources. That's a new experience for a lot of us. But there is true scarcity here. We do not have enough vaccine to go around. And so we are rationing, and we're rationing in a way that gets it to the people who are at highest risk. And we're asking those people who, unfortunately, there are a lot of people who we would love to give the vaccine to, and we just can't because we don't have enough. And we had, the governor made some tough choices, and the health departments are working hard to operationalize that. That's the number one thing I would say is this isn't a problem of us just deciding that we don't want to give vaccine to people because we don't want to use the vaccine. We just don't have enough. And we need people to understand that if you're using a dose, that's somebody else that's going to have to wait maybe weeks before they get that vaccine. And if you're in your 70s or 80s or 90s, this vaccine is a really big deal. This vaccine allows you to live your life a little bit more safely. It allows people, it's not just about not getting the disease. It's also about liberating people a little bit from feeling like they have to stay at home all the time. So I just want people to think about others. The same thing that I talked about at a press conference in March of 2020. Let's take care of each other. I think we need to continue to take care of each other as we move through this pandemic, because that's going to be really important. And it's only going to get more complicated as we move into new phases, and probably more confusing for people. So we just need people to have some grace, have patience, and work with us.
Matt, would you mind if I added to that?
No, not at all.
I think another thing is that this is not a zero-sum game. So when people in 1A and 1B are vaccinated, it's not really a situation where some people are getting vaccinated and other people are getting nothing. Every single person who's vaccinated is benefiting all of us. And in particular, when people with underlying health conditions or over the age of 70, or who are more vulnerable to the virus because of their ethnicity, when they're vaccinated, what that's doing is has a downstream effect of relieving pressure on the overall healthcare system. Because, right, if a person with a cardio issue gets vaccinated and then they don't get sick, that person's not putting pressure on the healthcare system, and that helps all of us. So I guess what I would ask the community to remember is that we're all benefiting from every single person that's vaccinated. And also, what an incredible place we are in. Because I remember that at this time last February, my recollection is that what we were hearing from the vaccine industry was that the fastest vaccination that had ever been developed and implemented was 4 years. Maybe Matt can help me out with that. But I mean, we are in a remarkable spot right now.
And I think the other thing that I want people to understand is it's going to get easier. I mean, every vaccine that we give takes somebody out of competition with others because they don't need the vaccine anymore. And every time we give a shot to somebody who's in one of these categories, it relieves the pressure on the overall number of people who are trying to get the vaccine. We're seeing signs that the Johnson & Johnson vaccine is going to get approved, and we may see meaningful supplies of the Johnson & Johnson vaccine later on in March. And as we move through this year, I think you're going to see more organizations being able to give the vaccine. We're looking forward to the days when pharmacies, I don't think that may be happening now, where pharmacies are able to give vaccines, urgent cares are able to give vaccines. Believe me, we in Bozeman Health and MSU are really looking forward to the day when we're not the only ones giving out vaccines. We don't need that to be the case, and we don't have any interest in preserving that. So as we move through this, we're headed the next, 60, 90, 120 days. They're going to be bumpy. We're going to continue to have scarcity, and we're going to continue to have competition for vaccines. I think as we move through the summer, there's going to be more supply, and there's going to be fewer people in need of the vaccine, and things are going to even out a little bit. So that is a good reason to be patient, right? Any other questions? All right. It was a slow start, but we finished strong. I appreciate all your time, and have a good weekend.
You too, Matt, Tracy, Kallie, thank you.
Thank you, everyone.